Welcome. My name is Brenda Suggett, and I'm the Executive Director of CARSP. Welcome to today's webinar, which is entitled Measuring the Impact of Drug-Impaired Driving, Recommendations for National Indicators, with Shawna Meister from the Canadian Centre on Substance Abuse. We're very excited to have her with us, and I will introduce her in a minute. First of all, I'd like to thank Transport Canada for funding our Knowledge Exchange and Training Hub program, which has enabled these monthly webinars. And I'd like to put a plug for next month's webinar, which is called Patterns and Changes in Risk of Motor Vehicle Casualties Before and During COVID-19 Pandemic. The COVID-19 pandemic by Dr. Evelyn Gillis out of the University of Western Ontario. And before I introduced Shawna, I also just want to go over some quick housekeeping information. Basically, we ask that you use the Q&A function at the bottom of the screen to submit your questions, and you can do that at any point during the webinar. However, we will only take the questions, answer the questions at the end of the webinar, so after Shawna has spoken. And feel free to use the chat area to chat amongst yourselves. Okay, so now I have the pleasure of introducing Shawna Meister. She is the Associate Director of Research at the Canadian Centre on Substance Abuse and Addiction. She conducts evidence-based research on alcohol and drug-impaired driving and on substance use and the workplace. Her background includes publications on various road safety issues, such as impaired driving, cognitive impairment, vulnerable road users, as well as alcohol and cannabis use, impairment and safety-sensitive industries, and impairment and workplace policies. So without further ado, welcome.
Thank you for the introduction. I'm just going to start sharing. Okay, so thank you, everyone. Just moving some things around so I can see better. Thank you for the introduction, and hello, everyone. So I thought I would start by just setting a bit of context around drug-impaired driving that kind of relates to this presentation. So in 2016, nearly half of all drivers who died tested positive for impairing drugs, and this wasn't including alcohol, so just drugs other than alcohol. From 2018 to 2019, drug-impaired driving incidents reported by police, they increased by 45%. And in some regions of Canada, THC is the most common drug found in senior drivers. And in some of those areas, that is the only drug we're finding in senior drivers. So these data are important because they tell us part of the story about the changes that are happening in impaired driving. So for us, for instance, who knew seniors were going to be our next cannabis concern? The reality is that we don't know enough about what is happening with drug-impaired driving. We really need to know more. From 2018 to 2022, CCSA worked with a group of national experts in impaired driving. Our goal was to develop indicators to better measure the impact of driving impaired by drugs other than alcohol. And so today I'm going to be sharing with you the 34 indicators that we are recommending. I'd like to recognize the experts from our Drug-Impaired Driving Advisory Indicators Advisory Committee. They have been both the co-authors and the key contributors on this project, and they really put in countless hours over 3 years and through a pandemic, so we really appreciate what they did to contribute to this project. I'd also like to thank the 200 professionals and experts from across Canada in impaired driving that we consulted for this project. Before I continue, I would like to respectfully acknowledge that the offices of the CCSA are located on the traditional unceded territory of the Algonquin and Anishinaabe people in Ottawa, and I am quite grateful to have the opportunity to live in this land. Okay, so I'm going to be talking briefly on the background and the work to developing the indicators. It's about a 25 to 30-minute presentation. I'll explain and spotlight a few of these indicators, and then I'll finish with some of the potential challenges and opportunities with with having these indicators. Now, if you're not familiar with us, the mandate of the Canadian Centre on Substance Use and Addiction is to provide national leadership to address substance use and addiction issues. We are an independent nonprofit organization. We are not a government agency, and our research is based on the scientific evidence. So I'm just going to start by giving a very brief background to the drug-impaired driving work that we've been doing. So why this project? Why do this? Well, as I mentioned before, we really don't know enough about drug-impaired driving, and I'll show you what I mean by that in a moment. But what this means is that we just might not be using the best approaches to reduce the issue because we might not have all the information. The objective of the project was to develop a set of national indicators that would work across the country, so all 13 jurisdictions, to better measure and understand the prevalence, the impact, and the reduction of drug-impaired driving. So in terms of the methods, this was a multi-year project. We consulted with nearly 200 experts from across Canada. These included law enforcement, hospitals, public safety experts, lawyers, anyone in the impaired driving field. We then formed a drug-impaired driving advisory committee from these experts, and this committee worked together to develop the 34 indicators I'll be discussing. So we do have a written report and some briefs describing these indicators. I'll share a link with you at the end of the presentation, but you can just go to our website, go to the impaired driving section, and then click on drug impaired driving, and you'll find all the resources that came out of this project. Now I'm sharing this slide with you to give you an idea of the main data gaps in impaired driving. So as you see in the table, of all the data that Canada could collect on drug-impaired driving, we really only systematically collect data from mostly two sources: drug-impaired driving incidents reported by police and drug-impaired driving fatalities reported by coroners and medical examiners, so the areas that you see in the green. Now these data are important, but it's not very helpful if the only data we are looking at to reduce impaired driving are when the driver has already reached some of the worst possible outcomes, in this case, crime or death. We collect little or no data from the sources you see in the light red region. So some of the missing data here include hospitalized drivers, other road users, or data from commercial drivers. Now, overall, because drug-impaired driving is underreported, for as much as we do know, we still have a limited understanding of it. Okay, so the indicators, what we came up with. When we began, the advisory committee identified over 70 possible indicators that could be used to measure drug-impaired driving. However, 70 was just way too many and really too complicated to account for the huge differences in Canadian geography and regional politics. Therefore, as a starting point, we spent time narrowing down the possibilities to 34 indicators across 9 areas. So what you're going to see today, it's not a comprehensive list. There's definitely lots more that we could do in this area, but it is a targeted list for starting to look at drug-impaired driving. Some of these indicators, they already exist, such as the police and the coroner and medical examiner data that I already mentioned. However, we really need a more holistic picture of what's going on in Canada. So we are recommending collecting regular and standardized data from 7 additional sources, including courts, hospitals, private and commercial roadside surveys, motor vehicle divisions, and public surveys. I'm going to begin with the indicators that we recommended for impaired driving incidents reported by police. There are 7 recommendations. And for us, this was really a useful place to start because these data are already commonly collected. Most people were familiar with them, and we could use them as a guide for developing other indicators. So on the left column, you can see the general breakdown of the 7 indicators that shows existing, adjusted, and new indicators. Under the existing indicators, these include data that we already collect relatively well, So for example, data on driver characteristics such as age and sex, as well as THC blood concentrations. This is something most people were doing, or pardon me, most policing agencies were doing, and they were doing it fairly well. Under adjusted, the committee's goal was to improve upon existing indicators. So this is where we standardize indicators or where we augmented the indicator. So for instance, just to highlight, we wanted to cover multiple drug use. Understanding polysubstance use was really important to the group. We know that the person who uses multiple drugs has probably different behaviors than someone who uses a single drug. So this was a recommended indicator that we augmented throughout many of the areas, and you'll see it in some of the other indicators that I'm going to talk about. Finally, the committee suggested several new indicators to collect data. So for instance, with the police, we recommended capturing data on how we respond to impaired driving. In this case, do we use sanctions or do we use criminal charges? And then how do we use the impaired driving tools that we have? So for in this case, for instance, standardized field sobriety tests or SFSTs. So given all of this, it was not enough to recommend indicators. We realized that for them to be useful, we would need to define them to be standardized across agencies and jurisdictions. We would need them to be reasonable to collect, and we would need the indicators to be clear to everyone using them. So there's a lot of text on the screen. You do not need to read it. The purpose of the slide is really just to show how we define the indicators to make them standardized, reasonable, and clear. So on the left are the 7 indicators for police that I showed you on the previous slide. And on the right side in the pink box is how we define them. So just to highlight some examples, the blue circles are an example of where we standardize the data. For instance, we standardize driver age groups. We base these on the CCMTA's age categories. The green underlines are an example of how we try to make the data reasonable to collect. So we recognize that jurisdictions, due to their size and resources, they had different levels of capacity to be able to meet the needs for filling in indicators. While some probably could collect very complex data, others told us that, we're still collecting just numbers and percentages. So in many of the cases, we started with the base level that everyone could start with, numbers and percentages, and then individual jurisdictions can scale up if they need to. And the pink box is where we provide clear definitions of the data to be collected. And we made an effort to ensure these definitions or the same definitions were used across the other agencies where we're collecting the same data. So for this presentation, there's just not going to be enough time for me to go through all 34 indicators in this level of detail. And it's probably going to be easier for you to look at the report or look at the piece of paper in front of you. So for the remainder of the discussion, I'm going to touch on the indicators, but I'm not going to go into the details that define them. Since police share a substantial resource burden when enforcing drug-impaired driving, the committee felt it was also important to measure the resource use for this agency. So we recommended 4 indicators to measure resource use by police. Among the existing indicators, we continue to suggest collecting data on officers trained in SFSTs, in approved drug screening equipment, so ADSEs, and also for those officers certified as drug recognition experts or DREs. But we also added 2 new indicators, one on how many times a DRE is requested for an evaluation, and one for the number of blood demands requested. Now, the purpose behind those 2 new indicators is really not only to give us a good sense of what the demand is for requests, which could give us some insights into individual regions if, for instance, there's a high demand for any of these tools, but they also give us a better sense of whether or not there are sufficient resources to meet those demands. And so that kind of data can probably help support policing agencies if they're trying to make a justification for increased funding. In the judicial area, so among court data, we also developed 3 indicators to measure drug-impaired driving. We continue to recommend collecting driver characteristics such as sex, gender, and age, as well as the type of sentencing and also the type of disposition or what the outcome was of the sentencing. Now, data like these, they can be used in conjunction with other agency data to kind of help understand patterns or potential trends and issues or effectiveness in what we're doing. So for instance, we could use court data, and it could be compared to other data such as charge data from police. And this way we can kind of see if there's a patterns emerging in managing somebody who's arrested right through to the court system. This way we might be able to see, or better able to see, if certain approaches are more effective than other approaches, such as do penalties work better with certain types of drivers, or do diversion programs work better? We continue to recommend collecting drug-impaired driving data from driver fatalities. So with the fatality data, we realize that coroners and MEs, there's just a potential wealth of data that could be, gleaned from their reports. Could be driver history, could be medical conditions, it could be past issues, even their type of work. But these type of data, they can take a long time to collect and a long time to analyze, and they can be quite complex. So for the time being, we haven't suggested doing anything in greater detail with the coroners. Instead, our two key recommendations are to start by standardizing some of the practices across coroners and MEs, particularly with testing and reporting on substances present. And we also recommend automating the data by putting them into an electronic database so that different agencies can access the data more quickly, so that they can be anonymized, and so that they can be protected and confidential. Hospital data. So hospital data was identified by the advisory committee as one of the two areas to start prioritizing implementation of the indicators. And we really simply do not know enough about hospitalized drivers. It's not something we systematically collect data on in Canada. There are studies on injured drivers, such as those by Dr. Brubaker, and they demonstrate already that we're missing a lot of valuable insights into impaired driving. They also show that we're missing opportunities to intervene with drivers sooner to prevent further harms. So here, we're recommending collecting 4 data in this area: driver characteristics from hospitalized drivers, substance present in the drivers, and injury data from the drivers. Like hospital data, roadside surveys are really immensely informative in giving us a much more accurate picture of the average Canadian driver. For those of you who may not be familiar with a roadside survey, these are surveys that are conducted at an actual road location at different times and different locations. The drivers are randomly selected and they are safely pulled over, and we ask them a few survey questions and for a sample of their saliva for lab testing. Now in Canada, we really only conduct passenger and light duty roadside surveys. And because of the cost to conduct these types of surveys, we only conduct a few of them in a few jurisdictions. So this is why we're listing these indicators as new, because while we do have some studies to draw upon, we don't have a wealth of them. And so I would consider the data still relatively new for us and needing more exploration. We also don't conduct commercial roadside surveys, and yet this group of drivers, they pose some of the most serious risks in impaired driving just due to the size of their vehicles. There is a draft protocol coming out, and some considerations for testing the commercial roadside surveys, but I don't have any other information on where that's at this moment. So in this area, the advisory committee recommends that commercial roadside surveys be the other priority, along with hospitalization data, as the 2 places where we recommend to start implementing some of the new indicators. We also developed 5 new indicators for measuring driver record data from motor vehicle divisions. So motor vehicle divisions, they offer a really good opportunity because they're one place where driver data must be maintained, The driver data is already connected to other types of data, and sometimes it contains medical information on drivers. So these agencies, they offer an opportunity to look at data in an anonymized form, and it's already linked to various sources. So it helps kind of start building and filling in some of those gaps. In terms of the indicators that we recommended for motor vehicle divisions, we suggest collecting, of course, driver characteristic data, data on administrative sanctions, and on criminal data. And if we can determine or we can develop a protocol or an appropriate way to measure correctly recidivism, there's also an opportunity to examine repeat offenses. Lastly, we recommend collecting data from drivers themselves through national surveys. So in Canada, we do not conduct national surveys on just impaired driving themselves on its own, but there are other surveys that are very helpful, such as the National Cannabis Survey or the Canadian Alcohol and Drug Survey. But because their focus isn't primarily on driving, they're kind of missing, not capturing some of the nuanced details that those of us in the impaired driving field might be more interested in. So for instance, driver behavior and driver decisions when it comes to consuming a substance and then driving afterwards. Okay, so that was the 9 areas, and I realized that was a really quick look at the 34 indicators. If you want to kind of have a slow down version of it, I suggest going to the website and downloading the report or some of the briefs. And again, I'll share that with you at the end of the presentation. So almost immediately after beginning the project, it became very clear that we could not just put forward recommendations for indicators. We really had to take into consideration the potential challenges to implementing some of these measures, especially the new indicators where people hadn't been collecting this data previously. It was beyond the scope of this project, but the advisory committee, they felt this was so important that we developed an entire chapter devoted to suggestions for implementation. So some of the suggestions included data sharing. So data sharing, hands down, this was the #1 request we heard from almost everyone we talked to. Everybody would like to see everyone else's data. That's not a surprise. We heard from a lot of people that they feel like they're working in silos, trying to address such a huge problem. So if we could find ways to share data, that would be helpful probably to the overall area working in impaired driving. So to help in this area, in the report, we provided some Canadian models and some international models that demonstrate how to share data in an anonymized and private and confidential way. So while we might think that it isn't happening, we do actually have models even within Canada that demonstrate how we can share sensitive data. So the report touches on some of the ways we can do that. We also provide suggestions to help improve systematization and standardization. So some of those suggestions we already implemented directly in the indicators. You saw how we tried to standardize some of the definitions between agencies. But some of the other types of standardization are beyond our scope to be able to do. They really have to occur at the agency level. So in those cases, we did offer some potential ideas on how agencies could undertake standardizing their work. We recognize they know how to do some of this, but we just were offering some suggestions to help, set a platform for that. Technology and cost, these were also other issues that we heard. So while talking to experts across the country, we came across different ways in which some of these different agencies were addressing issues. So we tried to share some of this information in the report just to help share some ideas and to help broaden the ability to collect some of these data. Okay, so just to finish out the talk, opportunities and takeaways from what we learned in this situation from this project. First of all, we're really hoping that the recommendations provide a few opportunities to support all agencies trying to reduce drug-impaired driving. To the best of our knowledge, no one has put forth a set of national indicators to measure drug-impaired driving in Canada. So these recommendations, they offer a potential holistic approach or framework for better understanding the issue. The indicators, they're already standardized and they are ready to be implemented across agencies. So we hope this helps facilitate the process. The recommendations, as I mentioned before, they're not comprehensive. At the beginning, the committee came up with over 70 indicators. So there are definitely opportunities to augment what we have here, what's already done, and kind of to build on it and to expand on measuring drug-impaired driving. And finally, we really hope that the recommendations will encourage further interagency collaboration. So I'd just like to kind of close out by saying, telling a story backed by evidence-based data, it improves the chances of decision makers taking action, providing funding, and supporting the work. So if people can relate to the problem and understand it, they're more likely to support the efforts to reduce drug-impaired driving. So the data are a good starting place. And as we start to connect it with, things that are personal to people, I think we'll gain a little bit more traction in helping to implement some of these indicators further. So the report is it's called Measuring the Impact of Drug-Impaired Driving, Recommendations for National Indicators. Because we recognize there are multiple audiences for this project, we also developed 10 briefs focused on national considerations, but also on each of the individual agencies. So if you're in agencies such as motor vehicle divisions, you can just pull out the brief for your division. But the report does help provide some of the background and further information for understanding the whole piece together. The products are available both in French and English. As I mentioned, you can find them under impaired driving, then under drug-impaired driving. And I think I'll just leave you with this one last thought. Now, one of the advantages, and this has been something that a few people have been approached me and told me about this, is one of the advantages of having this report and the briefs is that they start to lay out concretely what Canada knows and does not know about drug-impaired driving. It demonstrates what we're doing and what we're not doing, and it's in writing. So they now have something in concrete, something tangible that they can present to people with the gaps and say, here's what we know and here's what we don't know, and here's where we can start making improvements. So we're really hoping that this product and this project and the reports and the briefs serve as a tool to start discussing these issues and start moving forward on trying to gain a more holistic approach to understanding drug-impaired driving. So again, I can't thank the advisory committee enough. They were just instrumental in getting this project off the ground. Thank you for your time. Thank you for having me here. I'm happy to answer any questions, or if you would feel better or would like to email me after, that would be great. And
Hey, thank you
thanks.
so much, Shawna. That was an excellent presentation, a great overview of some extremely important work that you're doing and that will benefit many sectors. And as you say, it's a great way to take stock in terms of what we know, what we don't know, because we can't change until we know know where we need to improve. So, and I started seeing some questions come in and also a couple of comments. And I just wanted to share a comment from Paul Bowes. You mentioned that it was just the, I forget what the category is, the sort of non-commercial type of roadside survey, but he said there's a project going on piloting it in Yukon, the commercial vehicle roadside roadside survey. And one person asked, will the presentation be made available on the website? And I guess that's a question for me too. Is it okay if we post this recording of our webinar on our website? And would you be okay with me sharing the slides? Anyway, we'll talk about that after.
Yeah, I don't have a problem sharing them, and we can convert them to something like a PDF for you.
Sure. Yeah, that sounds perfect. Awesome. Okay, so I will just jump right into the questions then and keep them coming in. Did you
just thought I'd
that?
say, yeah, just to Paul's point about the Yukon. Thanks, Paul, for saying that. I knew that the commercial roadside surveys that we were looking at them, but I wasn't sure to what extent they had launched. So it's helpful to hear that that the Yukon is actually piloting one. So that's great.
All right, perfect. Okay, so the first question is, would the insurance industry collect information that might be helpful. So is that a possible, or you probably looked at that as one of your, but I'm just curious what you'd have to say about that.
Definitely. Yes. The insurance industry, they do collect a lot of data, and I think they would be a good group. So they would be the kind of a next step. So we started with what industries we could feasibly talk about in terms of data. I think one of the things with the insurance industry is we would have to kind of have those conversations about what data we need and in what way we need it, because they have a different focus when it comes to why they collect the insurance, why they collect the data that they do. The other challenge is that there's private insurance and there's public insurance. So private insurance companies, because they're privately owned, they're not obligated to share or contribute any data. So the public agencies that we have in the country, and we had a couple of them in our advisory group, or at least one. We had so BC, I think Manitoba, Saskatchewan, and Quebec have public insurance. I think I might be missing one there, but public agencies already to a certain extent share their data with their other agencies. So those ones that are operated by government agencies. The private ones, though, it would require a little bit more work to kind of consider what we could do with them and whether or not they'd be willing to share that data. And we're talking a lot of private industries as well. We're talking about a lot of private businesses who probably collect the data very differently. So it's certainly a wealth of information, probably a next step. So encourage any efforts in that area.
Okay, thank you very much for that answer. I have another question here, and this person wanted to learn a little bit more about the process that you used. I know you mentioned this big advisory. Well, you originally went to like a larger group of experts, and then you developed this advisory group, and they were just wondering about the process for identifying the I guess types of information that you want to collect, and also like how you whittled it down and decided, like you must have had some criteria. You did kind of allude to that in your presentation, but I didn't know if you wanted to share a bit more about how you reduced the number of indicators to the ones that you had.
So, interestingly, we do get asked that question often. So I know a lot of people are interested in the indicators themselves, but they've also been asking us about the process of how we arrived at that. And yesterday, I actually gave a presentation on that process because there was a group who's also working on indicators. I had a slide for them, and I can probably briefly just maybe I can share or add it to the presentation deck for you to share so that people can have it. But maybe just a quick summary, like we started with consulting the experts, also the end users of the data, because if you want something to be meaningful, we have to know how they want to receive it. We identified the need, so the data gaps slide that you saw, that we had to see where the need was. We had to know our audience, so who wants this data. We started with the data we knew well, so we started with police data, and that's how we built things out. We wanted to simplify things, so standardization and then scale up. We really made a huge effort to use clear and plain language descriptions. That means more people will feel accessible to what we were presenting. We repeat the indicators across the areas where possible so that there's some consistency and so there's some common language between agencies. I think the biggest thing people have asked me about is the iterative process. We did start with 70, and we kind of went through this whole process of what are they all, and then for each indicator, and this was just the biggest part of the process. It probably took us 5 or 6 iterations where we started with what we had. Then we thought, could we actually do some of these indicators? Were they actually something we could do at this point? So we took out those that we couldn't. Then we went through the indicators again and we said, are we missing anything? Then we went through the indicators again and we said, okay, if we're going to standardize them, does that change our decision about what indicators we can include? And that actually had a big impact because some jurisdictions were too small to include certain indicators because it would be too identifiable. So that was an iteration. Then we went through iterations about, what's going to be that base level data. So it is an iterative process and probably too quick for me to describe in a couple minutes. so just a couple other things. We also acknowledged the challenges because we knew if anyone wanted to buy into these indicators, they were going to pose like, what's the challenge? Well, we don't have the resources to do this, or we can't share this data. So we had to come up with, we had to identify what those solutions would be so that people could focus on moving forward as opposed to what couldn't be done. And finally, we finished off by communicating in multiple ways. So that's why you see so many different products. There's a report that, a policymaker or decision maker won't be interested in, but a researcher might be. There are briefs that are more geared towards policymakers. So that's kind of it in a really quick nutshell. There's more to it than that, but I'll include the one slide that we did have for the other presentation I gave to you, Brenda, but yeah, it was a big process, and if you'd like more information, by all means, reach out to me. We can have a conversation about it.
Perfect. And I was just curious if that process is summarized in your report, your main report. Does it go in, or is it?
No, well, I mean, it's discussed a little bit in the methods section, which is in the appendix. But to be honest, because the project was so focused on coming up with indicators, to be honest, it didn't occur to me at the time that people would want to know how we did this, like that specifically. But I've been asked a few times now, how did you get consensus? How did you get that? So it almost warrants putting together like a little mini manual of, this is how we did this to get to arrive at this process. And there already are processes out there that do this in the research field, so Delphi processes, consensus building processes. So it's not that we're new, it's just we had to actually apply it to come up with this. So there are other options out there, but yeah, if you want more information, like the nitty-gritty details, by all means, reach out.
Okay, perfect. And that's great that you'll add that slide. Perfect. And I have another question here about roadside surveys. They said, what are the legal implications of randomly pulling over a driver for surveys, especially in regard to any testing? And I know we've also got Paul Bowes. He's on the call too. He could probably speak to that if you're not familiar, but
probably be a joint answer.
Okay.
Like from our own work, there's been studies done already in the past and investigations past that looked into whether or not there was any legal issues. And the way it's set up, because it's set up as a study, set up as anonymous, it's set up as the separation of law enforcement and researchers. So there's a lot of things in place already that make it, I mean, we wouldn't have been able to start doing roadside surveys years ago if we didn't already meet the legal requirements. I know there's questions about it again that have arisen in the last year, and Paul will be the better person to speak to that. But we go to great lengths. Like anytime you do something that involves people, you have to go through an ethics application. We go through ethics processes, and we do check with our lawyers and things like that. So they do check the boxes, but Paul, I'm open to you adding as much or as little as you'd like.
Perfect. Well, we'll just keep an eye out for any comments. In the meantime, though, I will share another question. So it's to do with the whole data sharing and linking data from one source to another. And the question is, it would be very interesting to see information on data sharing in the report. We would like to link the health data to the collision data collected by our police force. Without linkage, we don't know where motor vehicle related injury occurred or other information about the circumstances of the collisions. So that's a very good point.
Yeah, and that's kind of the $1 million question. How do we link the data? So on one level, there are already certain jurisdictions in Canada that do link some of this data or link some sensitive data. So I'll start with that. So some organizations like CIHI, so the Canadian Institute for Health and Information. We also have some provincial agencies, especially the ones with public ministries who have public insurance. They also have more linked systems. I don't think it's an insurmountable challenge because we've seen these systems in the other countries. So in the report, we recommend looking at the UK has a system that actually Canada uses in some of our provinces. So they have a data linking system that potentially we could explore and expand further for starting to link that. Another source that was really interesting for us is New Zealand. Now they're smaller countries, so they're able to do this maybe a little bit more easily than we are. But they have these two database systems where one is for private side, so businesses who put in people level data, and one for public, so health data and criminal data, other types of data. And they've set up a system and a process to be able to link all this data for their country. So we know it's possible, and it's possible to start exploring those as options. And I agree with you. It would be great to see that connection between what's happening with a motor vehicle issue, motor vehicle collision, with whether or not there's there's a fatality, whether or not there is an injury. We know that's a lot right now, that our systems aren't set up that way, but I think we need to start making those steps forward. So part of that is standardizing and coming up with some standardization methods between the data. But the other part is starting to find a system to integrate the data that collects all this. We do have, like, Stats Canada already is legally set up to hold sensitive data in Canada. Some of our health agencies are already set up to hold sensitive data in Canada and can be anonymized. So it is possible. I won't lie, it'll take some money, obviously, to develop a more interlinked system. And Canada also has laws about human rights protection. We are quite strong in that area. So there'll be a need to start to frame what that will look like in terms of maintaining anonymized or de-identified data and connecting it to other issues. But I think if we want to reduce problems, if we want to start looking at how people, not just the driver, but other road users who are impacted by a collision, we need to start connecting this data in a better way to start understanding the full extent of the problem. Hopefully that helps answer the question, but more work to be done for sure.
Okay, that's great. Thanks so much. Let me just see another one. Oh, and Paul did follow up. He said that the issue is police have the authority to participate in each province. And then below he put policies. So I guess there is, the authority and the policy to be able to do that. So, and another question is, are the roadside assessments policy or medically derived? Roadside assessments, I'm not quite sure, maybe.
I'm not sure I understand the question. I guess maybe just to say the way they work is it's our best way of seeing prevalence of substance use in drivers. So they're randomly set up. A driver is pulled over, randomly selected. They're given a series of questions, just basic questions. And then we take a saliva test. That saliva test is not analyzed at that moment. It's sent away and analyzed, a few days later. So there's no direct incident. And then we look at the data, and the reports are publicly available if you want to see them. There's roadside surveys online you can find for Ontario, BC. I think the Yukon is one of the more recent ones, but and they describe the methodology more specifically. But essentially what we're looking for is, for the number of people we pull over on the roadside, who are driving with impairing substances in their system. I'm not sure if that answers the medically or policy derived. Maybe just more clarity on that.
Okay, great. So we'll just wait to see if Dennis has any more information on that. But in the meantime, and I'm not sure if I heard this correctly, but you mentioned that changes to the roadside survey information that's being collected is one of the first places that these indicators are starting to be, like, the recommendations are starting to be implemented. Did I get that right?
Close.
Okay.
What we're recommending is there are 9 areas, and we recognize that everyone can jump in and start implementing these indicators all at once or to any great extent. So we're recommending that if you have to choose, The two areas we recommend to start looking at doing this are with hospitals, because there is potential for a wealth of information, but also earlier intervention to prevent harms. And the other area was commercial roadside surveys. We lack the data in that area, so we're recommending that that we start implementing some of the indicators in those two areas.
Okay, and just a follow-up question. So I know you're gearing this report and these briefs and so forth, I guess, to the agencies that might be using this information. I'm wondering if you might be also targeting the government departments that, and if you have a plan for, trying to persuade them to, because I'm sure, they need the authority from that level before they can make any changes. So I'm just wondering if you have any plans for, trying to get it implemented.
Well, because the areas cross both private and public areas, so and we don't have authority over any of these areas. These are recommendations, so we're kind of that neutral, evidence-based organization who's saying, here's what we found. Here's the evidence, and here's what we're recommending. So really, a lot of that drive has to come from the agencies themselves or from the organizations themselves. It's not our place to. We're not able to go in and do that. But I think as a first step, and this is again what I've been hearing from people, is like they now kind of have it in writing and say, look, we need to look at this more. Here's the gaps and here's why this is important. And it's laid out in these pieces so that they can start taking it to the decision makers to what we're hoping for is to make, decisions like, what can we do first? So is there some way we can start small and work our way up?
Okay, great. And one person, and this might be difficult to say, but they were just wondering if you have an idea as to when these recommended data, and I guess, you need to look at all your 9 different categories. And as you said, like if you want them to prioritize, I mean, it might be at different time periods, but are you starting to get a sense of how quickly this might get rolled out, and whether certain partners that you've been in touch with or already have plans to implement these things? I just wondered if, and also, would you be following that up? Is there a plan to follow that up as well?
Well, at this stage, so they came out as recommendations. And like I said, we're not in a position to tell an agency to do it. However, to your point, I've had a few people approach me now, or a few people have sent me emails and saying, look, we're starting to look at this. We've had a few agencies say, we're starting to put together these types of indicators, and they're also considering some of their own indicators that might be useful too. So they're already building on what is there. So in terms of a rollout, right now it's this is a recommendation stage. It's kind of, we need everyone to be aware of what the issues are and where the gaps are. And then moving forward, as I mentioned, we have individuals and individual agencies who said, we're already doing this, and some of this is starting to come out in other works. I've been contacted by different people who said, look, we saw this indicator, we thought it was important to have, so we're looking at implementing it. So a little bit of an early snowball effect, we hope.
Okay, very good. And I imagine because you had all these experts you initially consulted with, I mean, it's like this team of people across Canada that are already sold on this, and hopefully they'll be sharing it with their networks as well. So, okay, great. And I can't see any other questions. People are just thanking you. Let's just see. Yeah, they're just going to go to your website. Lisa Thompson from MTO has just shared that it has completed roadside surveys. And if people would like to connect with her, and she's left her email, she can look into more detail on that. So I don't see any more questions, and I don't have any more myself. So maybe we'll just wrap it up there, and thank you so much. It's obviously a topic very near and dear to people's hearts that are on this call. people seem to have really enjoyed it, and it's really sparked a lot of great ideas and food for thought. And I think people will be going to your website to learn more details about how it all happened. And we wish you the best of luck in continuing to get the message out. So, and thanks for doing all that great work and for sharing it with us. So
thank you, Brenda, for having me. And also thank you again to the DID Advisory Committee. They were instrumental in getting this.
Excellent. Okay. Thanks, everybody. Take care.